So Lance Bass of InSync recently posted on Instagram that he has been diagnosed with latent autoimmune diabetes of the adult, or what some people will call type 1.5 diabetes. It is an autoimmune disorder like type 1 diabetes, but it is generally diagnosed in people who are adults and is a slower developing diabetes than type 1 usually is. Very often people are misdiagnosed as having type 2 diabetes because A, they're adults, and B, they don't require insulin right away. But what happens is in the beginning, their pancreas is still able to make some insulin so they can be treated with oral agents. But because they are making these antibodies against their insulin producing cells, over time, they make less and less insulin, and very often these people need to be on insulin. So it's important, especially in younger adults who don't have the typical body type of someone who has type 2 diabetes, people who are leaner and have less adipose tissue, less fat tissue, who are diagnosed with diabetes and who, despite a healthy diet and exercise and maintaining a healthy body weight, continue to have difficulty controlling their diabetes. In these patients, it's important to check what's called a C-peptide, which is a blood test that checks to see how much insulin someone is capable of making, and to check for antibodies against the insulin-producing cells of the pancreas. Because if someone does have these antibodies, even though they still may be able to control it with diet, exercise, and oral medications, it's important for them to be prepared for the time that they will need to be on insulin.